Here we go, Treadwell DPT back with another anatomy breakdown, muscle by muscle. They were hitting another big boy of that upper arm, big player for pushing and pressing, huge for my gym bros. Good to work your biceps, but if you really want those big arms, you're probably more focused on this guy. We're talking the Triceps Brachii. Like I said, big gym muscle. Makes up about 2/3 of the upper arm's mass, but also an important clinical muscle, being a major stabilizer for functional pushing, transfers, and weight bearing through the arms. We've got plenty to talk about, so let's break it down. We'll hit origin, insertion, function, innervation, and wrap up with a few clinical tidbits. Our triceps brachii sits in that posterior compartment of the arm with 3 distinct heads. We've got the long head that originates from the infralunar tubercle of the scapula, crossing the shoulder as well as the elbow. The lateral head comes off the posterior humerus superior to the radial groove, and the medial head, which also arrives from the posterior humerus, but inferior to the radial groove. That medial head is the deepest of the group. All 3 heads converge into a common tendon before inserting onto the olecranon process of the ulna. Some fibers will blend into the antebrachial fascia of the forearm. This orientation gives it a really good leverage for elbow extension. And for that long head, we've got some influence at the shoulder as well. So just to reiterate, our origin and insertion of that triceps muscle, 3 heads, a long head that starts at the infralunar tubercle of the scapula, a lateral head from the posterior humerus just above the radial groove, and that medial head originated from the posterior humerus just below the radial groove, all 3 converging into a single tendon and inserting onto the ulna. As you might expect, the triceps brachii's primary role is elbow extension. The long head, because it crosses the shoulder, also contributes to shoulder extension and shoulder adduction. Collectively, the triceps are also really important for stabilizing the elbow joint during fine motor tasks, as well as controlling the speed of elbow flexion eccentrically, like when you're lowering a weight. This makes the triceps just as important in deceleration and control tasks as it is in those explosive pushing tasks. So really simple, straightforward action here. Primarily elbow extension, and then with the long head playing a role in shoulder extension and shoulder adduction. So it makes sense that in the gym, the triceps are extremely important for that bench press, for your dips, and for your overhead press. Our triceps brachii is innervated by the radial nerve. In fact, the entire posterior arm is going to be innervated by that radial nerve. Really looking at all the muscles of the upper extremity, looking at the muscles that the radial nerve innervates, triceps brachii being innervated by the radial nerve makes perfect sense. The radial nerve is the extensor nerve of the arm. Radial nerve C6, C7, C8 innervates the triceps brachii. Triceps brachii, no exception to the rule, posterior arm, extensor of the elbow. It makes sense that it would be innervated by the radial nerve. So definitely helpful to be familiar with that rule, those little tidbits for sure. We'll talk clinical relevance. Not too many tricep specific injuries. Definitely a possibility in powerlifters or contact sports guys, but really rare from what I've seen. From a rehab and performance perspective, the triceps brachii is definitely a workhorse. Not just for aesthetic arm mass, but for closed chain functional activities as well. So think transfers, crutch use, wheelchair propulsion, pushing off of the surface. I do find myself trying to provide more of those tricep specific exercises for my geriatric patients who need that extra help getting out of bed, getting off of the chair, pushing up from their wheelchair. Very beneficial to train that triceps, that elbow extension. So a good muscle for PTs for sure. Definitely much more of a gym muscle in my humble opinion. Big, thick vanity muscle, So we've got plenty of good research on how to get it bigger and thicker. We've got EMG studies that show the different heads fire differently depending on the task. So we'll get into that a little bit. Firstly, the long head generally contributes more to those shoulder stabilizing role. Of course, crossing the shoulder joint plays a role in adduction and extension of the shoulder. The lateral and medial heads as a unit do the brunt of the elbow extension work, actually. EMG studies have also shown that at low shoulder elevations, the long head has the major role in elbow extension compared to the lesser heads. While in those higher ranges of shoulder elevation, the medial head takes over as the major elbow extensor. So if we're talking 1 and 2, it's usually long head first and then medial head second. Lateral head activates similarly to the medial head to be more active at those higher shoulder elevation ranges, but to a lesser extent and with less force. Adding to that, there is a relatively recent MRI study which showed that 12 weeks of elbow extension training with the arm overhead produced significantly greater hypertrophy of the long head of the triceps and thus greater whole triceps growth. And that's compared to the same training with the arm at the side, and that was despite using lower loads overhead. Of course, the overhead position being the maximally lengthened position of the long head triceps speaks to the importance of muscle length during resistance training. Also highlights what may be the optimal training method for triceps hypertrophy. So if you want bigger arms, try adding in some overhead cable extension maybe. See how that works. Of course, exercise variation matters for activation with every muscle. To add even more variation, we've got a study that found that forearm orientation is a big factor in long-headed tricep activation. Using cable pushdowns with neutral shoulder, supinated grips using handle attachments produce higher long-head EMG activation than did the pronated grips, strap grips, or neutral grips. So another cool variation to try, and just keep all of that in mind for sure. Of course, load and time under tension are hugely important for muscle growth, but small tweaks like shoulder angle, hand grip, and attachment or bar choice can shift which part of the triceps you're emphasizing. All that good info can be leveraged into both training and rehab, so consider that next time you're hitting the gym. So there you have it, Triceps Brachii, the three-headed monster, the big dog in an upper arm. Remember what we mentioned, the long head is king and it responds best to overhead movements. But if you can't go overhead, try a nice cable pull down with a supinated grip. A little something to help both your gym and knowledge gains. Hey, another one, much more in store. Even more to come. Stay tuned, stay locked. Treadwell DPT. Catch you next time.